we can take it a little further and ask ourselves, well, why is it that the nervous system does this? Why is it that the nervous system controls and coordinates all other organs and structures and relates the individual to his environment? The best way to answer that is to really look at some ancient wisdom, if you will. We can go back and read this famous quote, "The only constant in life is change." And you know, we could certainly agree that today in particular, we're experiencing this idea of change and how we deal with it. So change by itself can also be called stress. In fact, when you talk to or you listen to Hans Selye, who coined the term stress and did preliminary experiments on stress, he was once asked, well, how would you define stress in the most basic way? And he said, well, the most basic way to explain stress is to just think of it as change. Really, any change that occurs inside of us or around us, the nervous system is there to respond to it. So change is stress and stress is change. Change is stressful because it challenges our survival. And the nervous system has mechanisms to adapt to stress to keep us alive. Really, the bottom line of what our nervous system does, and what I like to say, if ever you're studying neurology and you're getting lost in all the complexity of it all, and you say, well, why? I wonder why this neuron does that, or why this behavior occurs, or the answer is always, it's there to keep us alive. The nervous system is there to help us survive. So the next question you may ask is, well, how exactly does the nervous system do this? How does it accomplish its function? To answer that, we have to start with the fact that it requires information. In order for it to properly do its job, the nervous system requires information. So just like satellite dishes that are always there and ready to respond to information, we are inundated with receptors. We have interoreceptors, so you can imagine these satellite dishes inside our body, in all of our tissues, really in the blood vessels to signal, you know, any sort of changes in diameter or tension in the blood vessels, angulation of the joints, tension in muscles, any sort of problematic area like pain. And of course, we need to know what's happening in our heart. We need to know what's happening in our lungs and our digestive system to keep us alive in that very basic sense. We also have exteroreceptors, the senses. The senses are there to give information to the brain as far as what's happening around us. So with the interoreceptors and the exteroreceptors, the brain is able to get all that information from around us, to interpret it, and then to be able to respond appropriately. So we are inundated with these receptors. The receptor's job is basically to send information into the CNS. And then if the CNS can process and interpret this information, it can respond. The interesting thing, especially for us as chiropractors, is the way that the nervous system responds is by one very simple and direct method. To move things is all that mankind can do. And for this task, the sole executant is a muscle, whether it be whispering a syllable or felling a forest. So when we think about it, we know that we have these different types of muscular tissues in our body, and they all serve a function that is essentially to keep us alive, to adapt to stress. That is the job of the nervous system. We're basically marionettes. We're at the mercy of how the nervous system controls our muscles. So here we are. We have a body that sends sensory information to the central nervous system. The central nervous system then responds through motor circuits. And this beautiful simplification of how the nervous system works is known as the safety pin cycle, introduced by B.J. Palmer. So it's a really wonderful way to kind of examine the nervous system with your patients. Think about it in that way when you're doing your exams, and also to understand better what we're doing when we talk about adjustments as well. Now, if we get more specific into our core interest and the topic at hand, it's where our main interest is really the part of the body known as the spinal column, right? So when we're talking about reduced motion, we can talk about derangements or stresses in the spine. And how does that fit into this whole scheme of the safety pin cycle? In other words, if we have a mechanical stress, what effect will that have on the nervous system? And this is really where most of the talks about how the nervous system is related to the subluxation, this is really where we're getting a lot of flow, a lot of the new developments in our research, and a better understanding of the neurological effects of reduced motion. So mechanical stress, what do I mean by that? Well, we know as chiropractors that there's many different ways or many different scenarios that can cause mechanical stress or strain on the body, whether it's postural faults, bad habits of sitting or standing in different ways. Obviously, accidents will cause mechanical stress on the body. But can mechanical stress reduce spinal motion? Or how is it that it might reduce spinal motion? If we look at an example here, here's somebody who has a mechanical stress. This is an area in their spine that is not moving properly, whether it was from a bad posture, a fall, what have you. Mechanical stress has caused this area to be fixated. What we know from a neurological point of view is when an area of the body is not moving properly, this is sensed or perceived as a harm. This can potentially damage the area in question. This is not good. So the nervous system, in its wisdom to protect the body and to stay alive, will signal the central nervous system, and that signal is basically called nociception, the perception or the transmission of potential harm into the central nervous system. Now, we know from what we just said about the safety pin cycle that we expect a response from the CNS, and at the spinal cord level, that's exactly what happens. We have a motor response. So here's our safety pin. And we said that how does it respond to stress? It responds by muscle contraction. So it makes great sense that without knowing anything more, we're at the spinal cord level, so there's no consciousness involved here. We have reflexes, the most simple stimulus response circuitry known in the nervous system, that will protect, brace an area that is dysfunctional. An interesting thing to discuss as well from a clinical point of view is, well, what happens if this isn't fixed? What happens if this goes on for a long time? And if you can just think of, putting an arm in a cast, for example, or what we know about degeneration is over time, a joint that doesn't move will degenerate. We know that very clearly, and we can just simply take x-rays to diagnose that. And what will happen to the muscle? The nervous system, is it going to maintain, is it going to expend all its energy to maintain that muscle spasm? No. After a certain amount of time, the muscle will atrophy, just like the arm in a cast, right? We know how muscles atrophy over time when there's no movement. So this is an example of what happens at the spinal cord level. But we also obviously have to signal the brain. If there's an issue, if there's a problem, a potential threat, of course we need to signal the brain. And from a musculoskeletal point of view, obviously there's a lot going on here, and we're just going to kind of summarize the most important points. But the brain is also going to react to this dysfunction, but it's going to do it in a more complex way. So for example, if an area is irritated in your spine or painful, the brain is fantastic at changing your posture, right? Antalgia, it's going to actually contract other parts of your spine in order to relieve the irritation that you might have in another area. So while there might be a primary area of dysfunction, we can now create muscle tension or reduced motion in other areas to protect ourselves or to reduce this irritation. This is what chiropractors often call secondary subluxations or compensations. Now that's from a postural point of view. We can also talk about, well, what would happen when somebody moves? And if any of you have ever had like a shoulder injury or a knee injury, you know that it changes the way you move as well. So disrupted motor patterns will occur. Rather than moving the way you normally do, your entire body can get affected into disrupted or new motor patterns to to avoid this irritation. So patterns of normal proprioceptive input are profoundly distorted when articular nociceptive activity is added. This interferes with the normal patterns of motion, balance, coordination, and equilibrium. So we see that mechanical stress can induce or can reduce spinal motion, both at the spinal cord level through protective muscle bracing, or through higher centers causing things like antalgia or disrupted motor patterns. What if the CNS is stressed? And this is where I think things get really interesting when we're talking about reduced joint motion or subluxation. In other words, when we look at our safety pin cycle, what if that part of the safety pin is stressed? What if the central nervous system is stressed? What effect will that have on the body? And a simple example that we can use that's very logical is stroke. So we know if someone has a stroke, this is a central nervous system or a neurological stress, we're going to have physical manifestations from that stress, right? So when somebody has a stroke posture, you don't think to yourself, gee, you know, I wonder what's happening in his elbow, or why does his elbow have a problem, or why does his wrist have a problem? We say, no, the problem is up here. So we can look at the body, we can examine the body and decide or infer what might be happening in the central nervous system that causes problems in the motor system. Of course, once again, our primary concern is the spine. So when we talk about reduced motion at the spine, what may be some neurological stresses that cause changes in muscle tone around the spine, just like the stroke patient? So we can ask ourselves, can neurological stress reduce spinal motion? Well, to answer that question, we're going to do two things. We're going to first talk about normal function of the brain and the nervous system and how it relates to spinal tone. And then we're going to talk about, well, what happens when things are dysfunctional. So the brain controls spinal tone. That's one of its primary functions. So from the brainstem to all other areas of the brain that integrate with the brainstem, spinal tone is controlled by the brain. We also know that as we evolved, as our nervous system, as our brain evolved over time, this is directly correlated to our ability to stand erect. So our very ability to be biped creatures is a neurological phenomenon. It's due to the brain and its evolution. So if you have poor spinal tone, in other words, if you have a neurological stress in the central nervous system that's going to have an impact or a negative impact on spinal tone, we're now in a position where we see head forward posture as an example. So head forward posture from a neurological point of view is related to a lack of tone. All of these muscles, for example, are now less effective in maintaining an erect and well-aligned posture. And I like to give the example to my patients that this is just like, you know, a tree that's falling and we have guy wires holding onto the tree trying to keep it upright. All of these muscles in the back, and it's from the neck all the way down the spine, even all the way down to the gastroc, for example. All of these muscles are now going to be eccentrically loaded. They're going to be contracting. They're going to be squeezing the spine and reducing motion at the spine just to keep the person upright. And we know that the consequences on a mechanical point of view are the typical degenerative changes that we see. And it's not a shock that we see the same areas most commonly affected by degeneration in the spine, because the patterns are neurological and very common. We can also have asymmetry of spinal tone. In other words, if we have a difference between the left and the right side of the brain and how each side controls each side of the spine muscles, if we have an asymmetry from one side to another, we can expect things like lateral deviations in the spine or scolioses. Another function of the spine and how it relates, another function of the brain and how it relates to the spine is how it stabilizes the spine. So for example, if you were to lift your arm up, this is actually a dangerous situation. Why? Because your arm has weight, and if you don't compensate for that weight now away from your center of gravity, you are at risk of falling, or you are at risk of damaging other parts of your body. So in the intelligence of the nervous system, before you even lift your arm, your brain will stabilize your spine. So what we call shunt stabilization. So first, before the signal gets to your actual arm or any other gross movement that you do, your brain will stabilize your spinal muscles in order to allow that movement to occur in a safe manner. So poor stabilization mechanisms in the brain obviously lead us to this classic scenario, right, of the patient who says, I just bent over, or I just reached for a pencil and my back went out, right? So this is actually a mechanism or a demonstration of a poor stabilization mechanism related to the CNS. We know the brain also controls our balance, right? Why? Because it took us so long to be able to stand up. We want to make sure that we don't fall over. It's interesting to look at the anatomy of the body and how we're really structured as 3 inverted pyramids stacked one on top of each other. Like, this is absolutely amazing. We're a pendulum. We're an upside down pendulum. So the brain reserves a lot of energy and a lot of effort and a lot of circuitry just to keep us upright through balance mechanisms. So the flip side of that is, if we have poor balance control, we're going to have mechanical or motor consequences along the spine. If for example, I have a derangement in my brain such that I'm falling to the right, I'm constantly falling to the right, obviously the brain is going to try to compensate by stabilizing other muscles or contracting muscles around the spine to keep me from falling. When there's failure of that mechanism, then you fall. The brain also controls eye muscles, and I think this is an interesting area for us to really get into as chiropractors. Obviously, the neurology of eye muscles is very, very complex, but why it's important to us is because vision trumps the spine, and this is huge. What do I mean by that exactly? What I mean by vision trumps the spine is that given the choice between having a spinal problem or a visual problem, the nervous system will choose to have a spinal problem. If you have weak ocular muscles, as the example here is, if this person has weakness in torsion of the eyes, the nervous system will contract muscles in the spine to give you a new posture in order to reduce that visual disturbance. So eye muscle exam, for example, is crucial if you're interested in posture. If you're interested in concussions, we know that that's a really important thing to do. If you're interested in dizziness, eye muscles are really, really an important part of what we do. Finally, we know that the brain controls emotion, right? Emotion. So the emotional circuits of the brain are really built upon physical circuits. So why we think of emotion is that you can tell how somebody's feeling just by looking at their face, right? Their muscles of facial expression will tell you exactly how they're feeling. Their body posture, whether they're confident or depressed, will give you an immediate input into what's happening in terms of their psychology. So when we think of emotional states, this can also have a direct impact on the spine. And there's not one chiropractor on the planet that doesn't agree that when a person is stressed emotionally, their spine is tighter, right? Their areas of tension become more obvious. And this is all about fight or flight. We know that stress or psychological stress puts us in this fight or flight scenario. And like we said about how the brain stabilizes the spine, if I'm in a fight or flight scenario where I'm going to have to use my muscles to fight or to run away and fight, before I can even do that, I need to make sure that my spine is stable, or else I can't fight or flight. So spinal contraction in a distressed state helps us get in a ready mode in order to accomplish this. So yes, neurological stress can reduce spinal motion. So if you go from the example of the person who's had a stroke and how their limbs change in position or in tension, we can apply it to the spine in different scenarios as well. So when you think about this, it's really a chicken or egg situation when we talk about reduced spinal motion. Here we are with the spine with reduced motion, and we know that it can be a cause of central nervous stress. And we've got more and more research showing us this pathway. But what we should consider as well is that subluxation or reduced motion can also be a symptom of CNS stress or a problem in the CNS. So in summary, we've seen that we have different mechanical stresses and different neurological stresses that can have an impact on the tension and the motion in the spine. We've seen how the nervous system has mechanisms to adapt to stress to keep us alive, which is its basic, most primordial function. We've seen that the nervous system responds to stress via muscle contraction. So this brings us into an interesting scenario where we can talk about what is the definition of a subluxation from a neurological point of view. And what I'm going to offer to you is this. Subluxation is a segmental motor adaptation to mechanical and neurological stress. So that's what I've got for today. I don't know how long I ran, Erin.
Yeah, you've gone over time.
Sorry. No questions.
No, do you have any questions, Patrick?
No, I'm good. If anyone has questions, I'll be happy. Oh, I'm seeing chat here. I don't know if there are questions.
One of my questions to you actually was, I remember we spoke about this, which position do you think is the best position to adjust a person? Standing, laying down, like in a supine or prone position? Like neurologically, what has the best effect?
It's a really interesting question because when you think of gravity and the effect it has on mechanoreceptors, if you have somebody who's in a fragile state, for example, purely from a mechanical point of view and even from a cardiovascular or autonomic point of view, laying them down would be the least stressful position to adjust them in. Whereas, again, from a gravity and mechanoreceptor point of view, if you have somebody who's seated or standing, you now have maximal mechanoreceptor stimulation from gravity, and you can increase the amount of neurological impact that your adjustment can have. So personally, I try to adjust everybody at least seated as much as I can, if not standing. And I try to reserve the lying down to those people who are really fragile, like a concussion patient, for example.
Have you had any more questions come through?
Just a few insults, but otherwise, no. I think no. I'm just seeing just comments.
Okay, cool. So thank you very much for that, Patrick. I think everyone can give him a bit of a clap. Thanks, guys.
Thank you.
So from one Patrick to another, we got the other Patrick now. And let me search and get him so he can talk.
Okay.
Hello, Patrick.
Hello.
How are you?
I'm doing very well.
So let me just introduce you. Patrick is an amazing guy. He's like a super duper chiropractor that's been working in 6 different countries around the world. He's currently just setting up his new practice in Amsterdam. You might know him because of his chiropractic training seminar that he does with Aaron, who will actually be a speaker next week. And in his seminar series, what they do is they work on the tone of the adjustment, and that the power of trying to find that right point where to adjust and really optimizing your technique to improve your adjustment. And so tonight he is going to talk about tone and the importance of tone. Thanks, Pat.
Awesome. Thank you very much for having me. So actually, hey, Kirby, what's up? I didn't realize there's quite a bit of overlap. We have a very, very similar message. So I think that's a great thing. Let me just pull up my PowerPoint here. So, slideshow. What I want to do is I want to kind of go into kind of Dee Dee's original ideas and how basically a lot of what Patrick just shared is very, very congruent with the founder's original intention. And his idea was basically about tone being the entity, and tone meaning that reactivity of the nervous system, or that reactivity of the person. We have the intelligence, which is the immaterial, the material, which is the bone and the material, and then the energy that flows through it, and the expansion and contraction. And so Dee Dee's ideas were in aligning the neuroskeletal tension framework. It allowed that energy and that tone to express itself as well as possible for us to be resilient to external stresses and to have function in time with need. And so he believed that when we had structural distortion, what that would do is that change the actual tension and tone of the elements that carry this information. And as a result of that, that changed the way that we expressed in our life, the way that we could meet challenges, the way that we could grow and evolve, and even how conscious we were. So it's really, really interesting because a lot of what Patrick just went into is going to support that. Basically, I'm going to try and slide this out of the way here. Okay, cool. So basically, if you can see this graphic here on the right, you can see how the brain is at the top, and obviously we have the spinal cord inside, and it's connected via the meninges, via the dura, especially very, very well connected in the cranial vault, also down to the cervicals, all the way down into the sacrum. And actually, the meninges come out and form the dural sleeves as well. And it goes out and it actually becomes, basically later it becomes the epineurium, the perineurium, but also the epimysium and paramysium, and eventually the fascia. So it's completely connected from your brain to your little toe. There is this continuous connection and this elastic barrier that's transmitting this tension and this tone at all times. So it's really, really interesting. And his idea was that any structural or osseous deviation would create distortion of the structure. And as a result, it would change the tone and the energy and information that was going through that. Much like if you change the tension on a guitar string or a violin, and that changes basically the frequency through there. And so it's really interesting because that particular system, it preserves itself from a very macro level, from your neuroskeletal tension framework, all the way down to the cytological architecture, like literally into the nucleus of the cell and the cytoskeleton. And when there is this distortion, this mechanical distortion, it will very much change the energy that's transmitted. I mean, especially if he was just mentioning mechanoreceptors. I mean, that's ultimately what they do. They transduce this mechanical information and deformation into electrical potentials. And so his idea was that it was this structural phenomenon, and that was changing the expression of more or less our spirit, okay? And when we were aligned and we were functioning well, then that tension was normal, that tone was normal, and we were more adaptable to our environment. Where that begins, actually, let me go with one other thing here. This is straight out of the chiropractor's adjuster. And he talked about what is tone, what is tonicity. It's the state of healthy tension or partial normal contraction of muscles, ligaments, and nerves. Okay, and we as chiropractors simply adjust the tensor frame in order to return nerves and through them muscles and organs to tone to normal tension. Okay, so what gives us our tone? Basically, sensory motor integration. We are sensory driven beings. Okay, if you look at this representation here, more or less, if you look at the spinal cord, the blue are sensory inputs, the red are the motor outputs. And you can all see on there, sensory is far larger. It's up to 70% sensory input. And the vast, vast majority of this is somatosensory input. This back, the dorsal column, medial lemniscus, you got your spinocerebellar tracts, and then you've got the anterolateral system, the nociception, things like this. But the vast, vast, vast majority of it is for movement. How do we relate to a gravitational field? Okay, so we need to be aligned with this gravitational field. And we do that basically as we do that, that's what stimulates and builds our brain. As Patrick was just mentioning, as you go from this up to this bipedal position, that's why we have these huge brains and we have this massive cognitive capacity, ability to adapt greater than other animals, and also forward thinking, okay, the more human aspects of our brain, the frontal lobes. So this, basically this dendritic formation here, it's the interconnections, the synaptic connections, and you can't see it because I've got my screen right in front of it, but you'll see the very first one is right at birth. Okay, the next one is at 6 months, and then beyond that is at 2 years. And anybody who has children, who's ever been around children during 1 to 2 years of age, the big difference is they start to get up and line up with gravity, and they begin to toddle. And it's basically, as Patrick was talking about, that reverse pendulum and having to maintain this very complex movement pattern in a gravitational field is what gives us the capacity to harness that energy from the environment. Because ultimately, philosophically, the purpose of intelligence is to create force. And the purpose of innate intelligence is to utilize universal forces and convert them into innate forces. And how that happens predominantly is through resisting gravity well. And so the more aligned we are, the better that brain is going to work, and it's going to have a massive output that's going to change a lot of different things. So I'm going to skip through a lot of this because I think Patrick did a much better job than me on it. But basically, the ideas in these joints and basically your entire somatosensory system in the muscles, the joints, the ligaments, the cutaneous innervation, all of that is sending this massive input into your spinal cord. And that is actually what's driving the entire cortical structure. It goes to your cerebellum, your thalamus, lots of different connections, and that's what's giving us our output. And that's very important to us as chiropractors, because where do we have just a massive load of those? Axial structures, midline structures. So there's this, what's called a craniocaudal proximal distal relationship. So basically above, down, inside out, the higher we go in the spine and the more midline we are, the more of these receptors there are. And in this upper cervical spine, especially the suboccipital triangle muscles, it's incredibly rich with these mechanoreceptors. And so any area of deviation here is going to have just massive impact into our central nervous system. And we're going to see how that's going to change the tone. It's kind of hard because I'm moving my picture of me around. So this is really cool. This is from Modernized Chiropractic. This is the very first textbook that was ever done in chiropractic in 1902. And this was the initial view of a subluxation. And it was not a bone out of place. It was a field of motion. And basically it had a central axis. And we hear about like joint centration is quite common in the literature now. This original idea was in Langworthy's book in 1902 already. And the way Dede viewed this was not a bone out of place putting pressure on a nerve, but it was a disrelationship of these articular surfaces that was changing the body's ability to harness energy. And it was changing the nervous system on a global level, not just a segmental level. So it's really cool stuff. Then I do want to get into this a little bit. So what happens when we have this mechanoreception that comes in? It does a lot of things. It's going to do some things at the cord. It's going to do some things suprasegmentally up in the brain. And the very first thing in the cord is it's going to gate and inhibit a lot of that nociceptive activity. Okay, so when we're not moving well, then one of the very first things that's going to happen is you're going to have more nociception arriving at the cord, always. Okay, because this nociception is constantly firing. It's tonic information. And so when you lose that information, the mechanoreception, and it can't gate that nociception, you're going to start to see sympathetic windup at that level in the cord. Okay, so you're going to have sympathetic hyperactivity. You're going to see the increased tone that Patrick mentioned. So the alpha motor neuron is going to have more firing. There's going to be like a reflex spasm at that area. And it's also going to affect the alpha gamma coactivation. So it's going to make that muscle stupider. It's not going to be able to be as sensitive and as able to react to different perturbations in gravity. So that's the thing where you reach over and you pick up your keys, even though you can deadlift 200 kilos, and you throw your back out, because there's not good sensitivity in those muscles. So basically, when you lose that movement, It's going to crank up the sympathetics at a spinal level, and it's going to crank up the tone at a spinal level, at a segmental level, okay? Beyond that, the other thing that happens is when that nociception gets through there, I'm having to move this all over the place. When the nociception does get through and it's not gated well, it gets up to the brain, and we typically think about nociception as being pain, but it's not necessarily pain. It's threat, okay? It's something that it's noxious information. And that can be lit up by an inflammatory diet, that can be lit up by damage, but it can also happen just from losing the proper gating, losing the proper movement at the spine. And when that happens, it's really interesting because the vast majority of that nociceptive output doesn't go to your parietal lobe for localization. So it doesn't mean, my spine doesn't move, it hurts. It means that a lot of that nociception gets through and it gets to these higher levels that are firing off basically a systemic stress response. Okay, so it gets up to the insular cortex, and if it perceives it as a threat, the amygdala starts getting involved, and it starts basically, the alarm goes off. It's like firing a smoke alarm. And when that happens, it basically shifts our entire global physiology out of a balanced and centered physiology and into a stress or fight or flight. And that's really important because it's a very plastic mechanism. And so what that means is the nervous system is constantly learning that. And the better we're moving, not only is our brain working better, but we're gating at the spinal level much better this nociceptive input. And so when we're subluxated, especially in areas that are very, very richly innervated, we are shifting out of our normal like rest and digest physiology and into kind of an external focused fight or flight physiology. So basically on a global level, when that happens, when we start getting a lot of this nociceptive bombardment, or even, and this can happen from the bottom up, but it can happen from the top down, the neurological stress or emotional stress that Patrick was discussing as well. When that fires, we're going to see a tightening of flexor muscles. So you'll see this diagram here on the right. We tend to have that head forward posture. You have less volume in your chest cavity. Typically your blood pressure will go up. Your breathing is more labored. You're going to basically enact the sympathetic nervous system. So you're shunting all your resources away from that rest and digest, that center core, and they're going to end up going out to the periphery. And so you get these very tight flexor muscles. And it also, it's called like amygdala hijack, and it will steal resources from your frontal lobe. It's basically going to keep you locked in a stress response. And so typically what happens when we're in fight or flight, then all throughout history, what would have happened is either you're going to be the tiger's lunch, or you're going to fight or flee. You're going to get away. And what that has in common is that movement and refiring the system. And as we move the spine, especially, but all the joints of the body, then it's restoring that input and allows the nervous system to come back to center. So basically a lot of what we teach at Syntropy is about just kind of a global subluxation and moving the nervous system out of this threat and defense, this kind of exteroceptive, what's going on out in the environment, and moving them out of threat and back into ease and growth. And in order to do that, we need to restore the movement. But another thing we need to do is we need to be really balanced and connected ourselves. Okay, so it's very important. We teach that to people as chiropractors. How can you have your touch be very non-threatening? How can we maximize input in mechanoreception and minimize nociception and threat? And in doing that, that allows the system as a whole to kind of recalibrate where it's at. And any of us who've been in this profession for more than a week, you've seen people come in that are really stressed out. They're not even nice people to be around. You adjust them for a week or two, and all of a sudden they completely change who they are. They begin to interact in a different way. When we get those stress hormones to drop down, cortisol, adrenaline, all these catecholamines, people are more connected to themselves and they're more connected to other people. There has been a lot of research into stress physiology. Robert Sapolsky's done a lot of this work. High levels of catecholamines, high levels of stress actually makes us lose our ability to have empathy with other people. And so we see a much more of an us versus them mentality. It causes more xenophobia, more racism, more tribal type of mentality. And as we adjust people and we can restore this input, we can restore this natural mechanism that the body uses to get out of that fight or flight state and back into a normal balance state, then it really changes every aspect about them. And I think it really fulfills a lot of what Dee Dee was talking about having who they were born to be and who their spirit is expressed at a higher level when they're in those higher brain centers. I think I'm getting some messages come through here. So I'm going to skip some of this, but it basically is just the subluxation is kind of that plastic patterning from an ease, normal, balanced state into a threat state, into fight or flight. And when that happens and it stays locked in that, that's when we begin to see all these basically diseases of civilization here. You shift this physiology just from one adjustment. Okay, cool. So how does this relate to patterns of people who resubluxate at the same levels? Well, basically, let's go here. So if you've had this chronic subluxation for a long time and this area has not moved well for a long time and you're not able to gate that nociception, well, you're going to have a lot of plastic wind up at that level and you're going to have increased tone at that level. And because there's not a good sensory motor integration there, it's going to have a tendency to resubluxate. You've got some super segmental things that are modulating it as well, but people tend to show up in these same areas because of that plastic wind up. So that was Aaron Pirtle's question. Why do people tend to subluxate in the same areas? Let me see here. Yeah. Okay, so if I've run over, do we have any questions? Okay. So Giuseppe, so if the tone of each patient is different, thinking about what Patrick said earlier, like antalgic posture, adaptation posture, and considering what Heidi Havoc said about the velocity of an adjustment, should be no less than 100, I'm not sure. Do you think each adjustment should be with a different velocity or intensity according to the patient's tone? Or simply each adjustment should have high velocity and high intensity? Absolutely believe that every person is an individual and it should be individualized. A lot of times what you'll notice is that people that are really wound up and can't handle a lot of input, they're going to have that rigid spine. And so it's not going to take as much input, has been my experience. I usually start lighter with them. And then as people become more adaptable, more elastic, better tone, then they tend to be able to handle more input. And yeah, more input. Do I use any other modality to help with threat, stress? Yeah, state, mindfulness. You're welcome, Giuseppe. Thank you for asking. I do, yes, I encourage definitely breathing exercises, mindfulness, but also embodiment. I think there are top-down approaches, but I really like bottom-up approaches as well. Movement is huge to kind of reset the system. So I teach a series of movements to all of my people that are about integrating the spine, the vestibular system, sorry, that's not the spine, the eyes, the vestibular system, and the spine together, gaze fixation, try to get head basically moving properly. And I have them do that as well as the adjustment. How do you know not to overstimulate the patient? Generally, this is a very, very big question and one that we spend a lot of time on in our seminars. And the basic idea is if my goal is to move them from threat into ease, then we need to adjust them from a position of ease. A lot of times in the profession, people are taught to take things to a lot of tension and crank things down. Everything that Aaron and I teach is about adjusting from a place of ease. And so if the body won't allow you into that place, into ease, then I don't adjust them. So yeah. So that's the basic idea. Everything we're trying to do is to make sure that that they are basically at ease from the entire adjustment. Sorry, I'm going back and forth looking at these. So I think I've gone over a bit here. Aaron Pirtle, do you have any questions?
Hi. No, I don't have any questions.
15 minutes goes quick.
Goes pretty quick. There's one more now just from Mike.
Okay, considering what Patrick said about the eyes, if you've been adjusting a patient with tinnitus for over 2 to 3 years and tried different approaches, but nothing works. Would you try working with ocular muscles? That is a very specific question. Yes, I would absolutely. I have a very, I work with trying to get the spine moving as well as possible, and then getting the eyes to move in concert with the spine. So I'm going to definitely use a top-down approach. I want to make sure that the upper cervical is moving, that the occiput is able to move on C1, the craniocervical junction is working well. I want to make sure that I get equal tone in the suboccipital muscles. I want to see that the flexor tone goes away and their head is upright. And then I'm going to start giving them those exercises to integrate vestibular and ocular things as well. But yes, I would give that to them before 2 to 3 years. That would be part of my protocol. Okay.
All right. So
Good.
thanks so much for that, Pat. That was really, really good. Thank you. Thank you to both Pats, actually, you know, and it was really ironic that the both of you had a really similar message to give. No?
Yeah, it's good though. I'm glad that's getting out there in chiropractic more.
Yeah. So, and next in line, we have Anna. And I'll unmute you. Hi, Anna.
Hello.
Hello?
Yes.
Yes, she's on.
My name is not Patrick.
No, no, we had a change now. And
Yes.
so Anna is, if you guys don't know, she's a chiropractor who works in beautiful San Sebastian. She also is a lecturer at the Barcelona Chiropractic College. And one of her passions is to try and pull that, inspire people to get that inside out message out, you know, and she's going to do her talk today on trying to find that source. Also in the Facebook page thing that we had, you would see that we made a link to her webpage, and she's doing, you can subscribe to her page, and she's doing newsletters that's sending out, which are very inspiring as well. So thanks, Anna, and it's all yours.
Well, thank you. And it's very interesting. There is another overlap. For those who know me, you know, I'll be talking about mechanoreception and nociception for like 30 minutes. No. But the overlap is, I guess, that the body is amazing. That's, yes, that's definitely the overlap. And there's no overlap in my name either. So there's also not... no overlap in the fact that there is no PowerPoint. There's no PowerPoint. I guess I'm Stupid Men's alumni, and I'm not going to be using a PowerPoint. But I have just in case, a board here. And I'm actually a little bit surprised because I guess I might be the only one a little bit concerned about this whole, not only a little bit, about this whole coronavirus thing. So am I the only one that's a little bit, maybe? No? Anybody concerned a little bit? Hey? No? We're all good? So I have to say, and I talked about this a couple of weeks ago with a group of chiropractors. As a human being, I'm not concerned. And I'm not concerned in the average, the age average in my house right now is 70.3. And there are 3 people, and I'm 38. So do the average. My mom is 77. And my grandma's 96, and I'm not concerned about the virus. I'm not concerned as a chiropractor either, and I'm not concerned as a visionary. But I am a business owner, so how many business owners do we have here? Hello, yeah. So yeah, it's gonna become a little bit tough. So it could be, who knows what's gonna happen. Today's today, and we're doing great, and we just learned a lot. Thank you for reminding me of that science and how amazing the body is. But yeah, I have to tell you guys the truth. I was a little bit stuck with this whole situation. It's like, oh, what's gonna happen? And then I had a little bit of an aha moment. An aha moment related to our message, our vitalism, and also how it relates to being a business owner and what we can do with practice. Because I don't know about your situation in different countries, and I don't know where you guys are, but in Spain and in Italy, we're definitely in lockdown and we cannot not open. So for the ones that I mean, for those of you who can actually practice right now, super happy for you. But I guess this is a little bit more for all of you who are at home in lockdown. Is that okay? Actually, if you can practice, this message will be good too. So this is gonna be my slide for the day. Can you see that? Understanding this, and it's nothing about the thalamus and mechanoreception and anything, so it's much easier, I promise. Understanding this transformed my practice 2.5 years ago. I knew it here, but somehow something clicked and I applied it, explaining chiropractic to my patients. And actually you can use what Patrick A and Patrick B just explained, you can use it with your patients. So this is easy for us, which is, I think, to understand outside in. We normally include traditional medicine, surgery and drugs, right? You know, outside in stuff, we get that. This is what Patrick explained. The inside out approach is actually finding the distortion, and they basically spent more than 15 minutes each, by the way, explaining how the body actually just resolved. Like they did not explain anything about how to treat back pain, how to treat diabetes. No, actually you just find where the distortion is, and the body is amazing at doing the rest of the stuff. Yes or yes? It's amazing. And we know that. Where I found my own bullshit, and I'm not judging anyone, is here. Is where I actually found myself using chiropractic or the adjustment to treat stuff, having an expectation with symptoms instead of just finding a subluxation, which either with, you know, functional neurology or like through tone or whatever you want to do. I'm more like into upper cervical stuff, whatever it is, finding a subluxation, locating it, and letting it do its job. I was actually doing a little bit of treatment on stuff, but through natural means. And I realized there was a really fine line. And then the purer I got at this side of the line, the more fun I was having in practice. And how many of you, sometimes you're like at the end of a shift and you're like, I'm tired, I'm not liking this. How many of you go like, I'm not sure I will be able to retire at age 75 and being on fire like all these huge people in the profession is like, they're 80 and they're adjusting 200s a day. How are they doing it? Well, this was my decision, but I didn't want to do this. I wanted to do this. I don't know what your opinion is, but I think Pat A and Pat B are doing what they're passionate about, and you can tell. So now one day, my government tells me I cannot open my practice. And this is about teaching people, like this is about adjusting people. But then this crisis, like any other crisis, has brought the opportunity of like, yes, it is adjusting people, but it is teaching them about what vitalism is and how amazing their body is. So I just wanted to tell you that right now I'm putting all my energy, and I have no clue what lockdown is going to be about, how long it's going to be. But lockdown is for me about being unapologetically me, by the way, which is me. Without the adjustment, keep educating people about this and not this. And why I'm saying this is because, can I share a very personal story, a little bit vulnerable, yeah? Just don't quote me in this one. It's just like a very small group, right? Just don't tell anyone. I got up on Thursday. This is lockdown. It's very sensitive time. Our emotions are going up and down, probably because I'm not adjusted, right? I get up on Thursday, last Thursday, almost a week ago. And I have a horrible sense of loneliness. And it was because probably 70% of the stuff that I was seeing posted by our dear profession was this. And I'm not judging anyone because I was being part of this too. I'm like, we're fucking missing the point. We're telling people about stuff that they can do. By the way, it's not about the stretches, because stretches can be about inside out. But we're not telling them your body is amazing. Your body can fight this, or your immune system is amazing. We're telling them eat this or do that, because this is what you gotta do. So it's not about the recommendation, it's about the view or what goes behind the recommendation. And I was like, why are we doing this? And I didn't feel like we were doing that. And I don't know why the feeling of loneliness came. And then I just went through the feeling, which that's what lockdown does. You go through anger and then loneliness and then frustration, and then you're tired. And it's like, why am I tired? I'm just like, I haven't watched Netflix in 2 days. That's lockdown. All good. Then I got adjusted illegally, but I got adjusted. All much better now. I understand why. And then I realized it wasn't about, a vitamin D post. Because the key here, by the way, is not about the content. You can tell someone they need to sunbathe because vitamin D is huge. Or you can tell them, by the way, do you know what your body does when you sunbathe? It creates this vitamin D, which is part of your immune system, so that blah, blah, blah. So it's not about the content. It's about how we use this to remind the people how amazing the bodies are. And you can always relate it to nervous system or, chiropractic, whatever, which is actually very smart if you want to keep your business open later and keep your patients engaged. And you haven't closed, well, it's actually always good to keep them engaged in understanding what vitalism is. Make sense? And then the next thought was, what kind of content can I create right now for people? And then, of course, it's like 5 pillars of health, right? Emotional and exercises and whatever. And then I said, what do I need right now in lockdown? And I understand some of you are not in lockdown, so I get it. Or as a human being, what's the kind of, what do I lack normally? Do I lack information, or do I lack connection? Or do I lack, or am I missing somebody to tell me, I just love you the way you are and you're just perfect? And I was like, yeah, maybe in those lines. But I have never allowed myself as a chiropractor, right, to tell those things to my patients. And I was always going the info way. And I was like, sorry, I curse, and especially in these things, especially because it's not in Spanish, but fuck that. And how about I tell them, yes, your body's amazing. And why are you focusing on the virus when we can focus on what we can do? And yes, this is scary. And Anna, what do you think is going to happen? I don't know. When do you think my pain is going to go away? I don't know. Do you think we're going to be able to, I'm going to be able to get better? I don't know. They become the superheroes, right? They're innate and not me anymore. I'm just that person that knows a lot of stuff, not as much as Pat A and Pat B, but it's some of their information. If I ever need that information, I can ask Pat A and Pat B. But they are the ones that have to take charge and say, I want to change. And I want to get better. And I'm the one that says, I don't know, but you being adjusted, I'm 100% certain, and of that I'm certain, that you under chiropractic care you have a higher chance of getting better. And by the way, I'm a freaking good adjuster. That I know, but I don't know what's going to happen. And I don't know what's going to happen with coronavirus or, whatever. But I know that, being adjusted, you're going to do much better. And for me, that is the inside out way of building a practice, or the inside out way of dealing with coronavirus, or the inside out way of educating people, and the inside out way of being a chiropractor, by the way. It's like that inside out is like the biggest gift chiropractic has given me, for sure. And with dealing with finances, like half Spain is waiting for the government to do something. Don't wait for the government to take charge of your finances. You know what I mean? That is the inside out thing for me. I think I'm done. I think that was probably 15 minutes. Sorry for my intensity. They call me Tsunami. Mm-hmm. Somebody said, what do you mean exactly, Anna? That was like 5 minutes ago. So I've missed the point. Like, what do you mean about what? Sorry.
I unmuted.
Okay.
After me. I didn't exactly understand in terms of, you felt down because you felt like the whole chiropractic community was missing the point. Like, how like, I don't know, just examples, because I didn't quite understand what you were saying in the terms that they were being outside in, natural instead of inside out. So.
Yeah, let me tell you first that the fact that I went down, it was a very me thing. So I'm not blaming anyone. Like, blaming you for posting whatever would have been a very outside in thing to do. So I was very vulnerable. My atlas was out. And because of lockdown, we're all very vulnerable. And that morning I felt lonely. Then I observed it through, I got adjusted. I was like, yeah, there's nothing wrong. I felt lonely. But that made me go through a series of thoughts and feelings, which made me think the way I communicate with my patients. I would have, I try, but I would have never gone to Facebook and say, why are you posting this? For example, but a good example would have been, and I actually, this was triggered by a non-chiropractic group, but if I were to post something about psoas, and I am in my inside out mode, like I'm connected, right? I'm like, guys, do you know how important your psoas muscle is? Stabilizes your pelvis. They call it the muscle of the soul. It's huge. How about you focus on taking care of it a little bit? By the way, my friend is a really good Pilates instructor, and she'll tell you how to stretch your psoas. But it's about, you already have this amazing muscle built in you. How about you spend maybe a minute a month, which is way more than what most people would do, nurturing that muscle that you already have, which is already amazing because you already are amazing. Instead of these are 5 ways you can stretch your psoas because you suck and you are sitting all the time. That's, for me, is the inside out approach to dealing with an exercise. First, and this is my inside out way, because I hate being told what to do. I started drinking water every day, not because I was thirsty, it's because I realized that I needed to drink water and nurture my, I have never done anything because somebody told me to do. When I want something, I go, I want to exercise, I go to a personal trainer and I say, can you teach me how to do this? I personally, that's why I'm not judging anyone. I hate the outside thing. You can give me a list of 20 stretches. And I'm like, yeah, thank you. Thank you. I'm not going to do it, but this is me. And that's why I'm creating my practice from the inside out. That's what I call calling a practice from the inside out. You know what I mean? But if you love being told what to do, go ahead and give people recommendations. And that's what I tell my patients, by the way, which is not about coronavirus, but that's my report of findings. I have recommendations for these, which I think will help, speed up the process. If you don't want to do it, I'm going to love you anyway. But, you can do it. But that's, I'm not going to force them. But that's me. But I wasn't trying to like judge anyone. It was just me in a very vulnerable moment. I'm not in tsunami mode like now all the time. It's only 23 hours a day. Questions. What patients say when you tell them I don't know? To be completely honest, they love it. Report of findings. When I'm gonna get better? I don't know. But what I know is that you need to be under care and for these, and that, which it depends on the patient. And I have no clue how many weeks, how many times you're gonna need. I base it on instrumentation, pattern work, etc. Like if you need less visits, I'll tell you. If you need more, I'll tell you so. When am I gonna feel better? I don't know. How about we start adjusting you? We'll see. It hurts. I'm sorry. Do you want a hug? Like, my job is to keep you adjusted. I'm super honest. Like, I don't know. Do you know? But like, if they're the superhero when they heal, it's like, you have done amazing. Why am I taking a responsibility that's not mine? But that is me being super, this is me, and this is like, why not share? This is me being 100% certain with my own body going through epilepsy. How I dealt with epilepsy and trusting my body, trying to live without meds for 3 years and having lots of concussions. I feel like, can you look at my eye movement? My gosh, talk about concussion. I got to trust my body for so long that I'm like, it hurts, so what? It's not about how you're hurting or not, it's about how you're functioning. Talk about opportunity in crisis. No more questions? No more questions. Okay. I don't know how many minutes, but I think that was past 15 too.
Yeah, I think everybody went over 15, but that's all right.
You're welcome.
I just wanted to say thank you to the 3 speakers for tonight. Thanks, guys, for that. And like you said, Anna, I think we are all a little bit nervous about what's happening right now, you know, and it's just good if we can just all keep together and just keep spreading our chiropractic message, whether it is from your own innate or what's the neurology of the subluxation, whatever it may be, you know. I just want us to keep our head in the right place. Yeah. So good night.
Thank you for organizing
everybody.
this, by the way.
Sorry?
Thank you for putting all this together.
I know, it's been fun. I got nothing else to do. So guys, good night. Thank you so much. And I hope to see you all on the call on Monday. Bye, everybody. Thank you so much.
Bye-bye.